lesson, we are going to be talking about chickenpox. Chickenpox is caused by the Varicella zoster virus, so sometimes you'll just hear it referred to as varicella. Chickenpox is a highly contagious viral infection, and the thing that almost everybody remembers about it or knows about it is that it causes a widespread, very, very itchy rash. Another thing to remember is that because it's actually caused by the same virus that causes shingles, so varicella zoster virus is also responsible for shingles, the virus can actually reactivate later in life and cause an outbreak of shingles. And this is most commonly seen after the age of 60 or so. Chickenpox is spread through contact with the rash and then can also be spread through coughs and sneezes. So these patients actually need to be on standard contact and airborne precautions. So having chickenpox sort of used to just be like a rite of passage in life. And parents would even have chickenpox parties just to sort of get their kid exposed to it and get it out of the way. The CDC does not recommend this, and this is especially true now that we actually have an immunization for chickenpox. And this immunization is given sort of exactly the same time that the MMR vaccine is given, so it should be easy to remember. MMR and chickenpox are at the same time, so between 12 and 15 months, and then again between 4 and 6 years. The major symptoms that you want to be on the lookout for in your assessment are fever and that really itchy rash that I mentioned. The rash actually has 3 stages. So it starts out as a pustule, and a pustule is just like a small raised bump that actually kind of looks like a zit. And then it moves on to become a vesicle. And a vesicle is just kind of like a fluid-filled blister is what it more looks like. And then that vesicle or blister kind of bursts and then it crusts over. So the crusty part is the last stage of that process. And one more really important thing to know is that kids are infectious until all the pustules, the entire rash has crusted over and is drying out. And as you can imagine, or you may even remember from childhood, kids with chickenpox can be pretty miserable and irritable. They're not sleeping well and they just feel pretty awful. So that's one really important symptom that parents may really struggle with. For your therapeutic management, probably the first thing you want to think about is your infection control. So if you're in the hospital, these patients need to be on airborne precautions and also those contact precautions because you can get it from touching the lesions. And then if they're at home, you got to let those parents know that they have to stay away from school until all the lesions have crusted over. Probably the most important part of our nursing care, other than sort of preventing it from spreading, is promoting skin integrity. Okay, so one of the biggest complications that we see with chickenpox is cellulitis. That skin is getting infected because they're scratching it and exposing the skin. So make sure that parents know to keep their kids' nails as short as possible. And again, this is to prevent them from breaking open their skin when they're scratching. If the skin is open, they are way more likely to get a secondary infection. If the whole not scratching thing doesn't seem like a feasible goal, then we can put mittens on the hands as well to protect that skin. Baths and calamine lotion are also really helpful to help keep those kids comfortable. So there are some medications that we can give that can be helpful during the chickenpox infection. The first thing that we might do is give some diphenhydramine to help with the itching. They may need antipyretics to help with the fever, so things like acetaminophen and ibuprofen. Just remember, we don't give aspirin to kids because there is a risk for them developing Rye syndrome. And the last medication that we might give is acyclovir. Acyclovir is an antiviral medication, and it should be given in cases of severe chickenpox and for patients who have compromised immunity. As with all of our infections, we've got to be monitoring for complications. So things that we want to be on the lookout for that tend to cause the most problems for kids are varicella pneumonia, encephalitis, and then those secondary skin infections I mentioned. When you are providing nursing care to a kid with chickenpox, your priority nursing concepts are going to be immunity, infection control, and health promotion. Okay, so let's just go over your key points for this very classic childhood infection. Chickenpox is a super contagious disease that is caused by the varicella zoster virus. Patients with chickenpox that are in the hospital, they need to be on contact and airborne precautions. And remember, if they're at home, they are contagious until all of their rash has crusted over. Now, the major symptom of chickenpox is that very, very itchy, irritating, and annoying rash. And that rash is going to go through 3 stages. You have the pustule stage, the vesicle stage, and then the crusting stage I just mentioned. Our treatment is really going to focus on skin care because we want to prevent those secondary skin infections. And then remember, in severe cases, a cyclovir, an antiviral, may be given. The most common complications that we see are varicella pneumonia and then cellulitis. All right, you guys, that's it for our lesson on chickenpox. Make sure you check out all of the resources that we have attached to this lesson. Now go out and be your best self today, and happy nursing.